everybody. Harvey Olivio, clinical instructor at Carrington College. I got the respiratory guy, Mr. Houston, on video.
Greetings, everyone.
We are going to do our competency for extubation. Like everything else, you want to check your orders. Make sure you have an order first. Do not attempt an extubation without an order. Also, make sure you have all your PPE on first. So I'm going to have gloves, gown, goggles, protective eyewear, whatever I need for this extubation. For the video, though, we are not going to put that on just so that we can demonstrate for you. When we are going to do this, we want to make sure we look at the chart and make sure everything's good in the chart and we checked everything. We want to make sure we do a spontaneous breathing trial, and depending on your facility, that may vary. So I'm just going to give you the one that we use. So typically I make sure my patient can follow commands. So if this was my patient, I would ask them to wiggle their toes. I would ask them to lift their head up off the pillow. We want to make sure that the ventilator's on some good settings. We don't want a high PEEP. We don't want a high FiO2. So typically a PEEP of 5, 40% of FiO2, and some low settings. We don't want a person that's on really high vent settings. They're not quite ready. So after I CPAP the patient, I'm going to have them do what's called pulmonary mechanics. So you want to make sure you get a RISB. Make sure your RISB's good. Make sure your NIF is -20 or greater. The higher the number, the better. So if they're doing -40, fantastic. Make sure you're doing vital capacity, and the numbers will vary with different hospitals. I like to say 600 or greater, but if they can do 800, 1,000, fantastic. Also, you want to make sure that they have a cuff leak. So you have to deflate the cuff on the patient, and you want to hear some gurgling sound once you deflate. So if you hear the gurgling sound, that's a good indication that you have a cuff leak. If you deflate and you don't hear any gurgling sound, that means that there's probably some swelling going on, and you do not want to extubate that patient. You want to make sure the doctor knows that. There is medication they can give to help with that swelling, and they may need to delay the extubation until they take care of the swelling. Okay? The other thing I like to mention that we want a good blood gas. So doctors vary with that too. They might CPAP the patient for half an hour. They might CPAP for an hour. Look at the blood gas, make sure all the numbers are good, make sure your pulmonary mechanics are good, and then I also like to look at the x-ray, because I've had patients in the past where the RISB's good, the pulmonary mechanics are good, the blood gas is good, but when you look at the x-ray, one lung is completely whited out. So if that's the case, they may need to wait before they extubate and either give the patient some medication or maybe do a bronch or do something about the lung being completely white out. Okay, so after you've gone through all your checks and determined that this is a patient that we do want to extubate, I'm going to explain the procedure to the patient. Mr. Johnson, the doctor said everything looks good. We're going to go ahead and extubate. So I'm going to raise the bed. So you do want to put the patient in like a high Fowler position. Okay. Also, you want to make sure you have everything ready to re-intubate in the event that you did need to re-intubate. So I do have my intubation box here. I'm not going to take everything out, but everything's in here that we would need to re-intubate the patient. Also, you want to make sure you have your suction ready. So I have my suction, my Yankar suction, and I have my Ballard hooked up. I also have my ambu bag ready to go in case I need to use it. My mask is attached, and then I also have a nasal cannula. Now we only have one oxygen and one air source, so I'm pretending that my nasal cannula is hooked up to oxygen, and I would set that at whatever I'm going to start the patient off on. So if I extubate and I want to start at 4 liters, that's what I would run it at, but have that ready to go. Okay, so now Mr. Johnson, I'm going to go ahead and suction. I'm going to go ahead and give him some extra oxygen so that we can suction. So I am going to suction the ET tube first. Okay. Make sure that I get all the secretions out of there. Now I'm going to suction his oral cavity to make sure I get everything in there that I can get before I take this out. Okay, and I'm going to leave this Yankar hooked up and running because I'm going to use it once we extubate. I like to use a chuck. You can use washcloth, towel, whatever you want. but I prefer to use a chuck because it all gets tossed into the trash once I extubate. Okay? So Mr. Johnson, when I deflate your cuff, I'm going to have you take a big breath in and cough, 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 cough as I pull out. Okay? So right now, I'm going to deflate his cuff. Okay? So I'm going to take all the air out of here. In the real world, you're going to hear gurgling. Okay? If I need to suction again, I can suction again right now because everything's ready. Okay? Then I'm going to loosen up his tie. So I'm going to go ahead and unsecure that. Typically, these are pretty sticky on the patient's face, so be careful because you don't want to cause any damage to their skin. So take them off easily. If you need to get an alcohol or adhesive remover, you can do that too so you don't hurt the patient. So make sure that this side is also off. It's deflated. Okay, Mr. Johnson, take a huge breath in and cough, 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 cough. Very good. So a lot of times after you extubate, the patient's going to want to talk. They're going to want to tell you that they're hungry. Mr. Johnson, it might hurt you a little bit to talk, so maybe don't talk too much because your throat might be sore. I'm going to go ahead and put your oxygen on. We're going to secure that. My mannequin does not have good ears to secure it to, so I'm just going to pretend that I have this on really good. But I would monitor his vitals, make sure he's doing well, clean up my mess. I may need to suction his mouth again or leave this running because he may have some secretions that come up orally when he coughs. After I'm done, clean up my mess, thank the patient, throw this away, document everything, okay? And then evaluate the patient, make sure he has no issues, make sure that he's feeling okay, make sure his vitals are good, and that is it. Thank you very much.